We just talked about private, that there's a lot of flexibility, in public, maybe not so much flexibility. And I feel that's the beauty and also the complexity about the German healthcare system. Beautiful because you can actually choose the coverage that you want very individually, either in private completely or with private additives on top of the public health insurance. And complex because it can get confusing very, very quickly, given that there's hundreds of different plans. To help our viewers watching the interview, can you recommend the right health insurance coverage for specific groups of people watching?
I can try. I mean, the simple answer, I think I've already given that, is that for most people, public health insurance is the best option. Switching from public to private can be a little bit easier than vice versa. Yeah, if you want to look at some groups, say average person with an average salary that is employed in Germany, public health insurance. For students that are enrolled in a university and younger than 30 years old, again, public health insurance. If you are an artist and can join the KSK, which is a special fund for artists, again, public health insurance is a fantastic option for you. If you have a family with multiple children, then public health insurance is great. Again, especially because you can cover your whole family under one plan. And then on the other hand, if you are a high earner, employed with a German company or a remote worker somewhere else in the world, especially if you're single, then private health insurance can be a great option. One thing about private health insurance that makes it a little bit more complicated is that your health plays an important factor. So if you have severe pre-existing conditions, then they're usually fully covered by public health insurance, where private health insurance may not cover them, or you can't get private health insurance. So in that case, you would also be served well by public health insurance. I'm a big fan of public health insurance, but it also has to be said that if you have public dental benefits are quite limited with public health insurance. So what a lot of people do is they get some additional dental insurance with their public plan to make sure everything is covered, and they don't have to pay a lot of money if they want to see a dentist.
I can really see that you're team public health insurance, while I'm more team private health insurance. People could let us know in the comments which side they're on. Maybe a compromise between the two. So staying in public health insurance and topping it up with private additives, either in the dental, the doctor, or the hospital segment, may be a good compromise, a good option for people, especially if they can't switch to the private health insurance system. What do you think?
I agree. I think we see that especially dental insurance is very popular with everybody that has public health insurance. So it can be a great inexpensive add-on to top up your coverage. And then like we discussed, private health insurance, maybe that is a little bit more for the kind of expert user that is really interested in kind of understanding the differences between public and private, and has no problem to maybe do some research, dive into the details. And this can definitely be a time well invested, because there are certain cases where you can make significant savings being on private health insurance, especially if you're not planning to stay in Germany for decades to come, but maybe just for a couple of years, and then want to move to another country after that.